just where you develop abnormal cells in your breast tissue and lymph nodes. Anyone or that would like to speak have a family history of breast or ovarian cancer would like to raise your hand. So those that do, that have raised your hands, just having a family history of breast and ovarian cancer in your first degree and second degree relatives puts you at a higher risk of carrying the genes. There are 2 genes that you can get tested for. They're called BRCA1 and BRCA2. And most doctors, especially surgeons, when you get referred after finding a lump or abnormal cells, they'll refer you to genetic counseling, like your first degree, especially kids, sisters, brothers. And just to go off of the stigma, most people are unaware that males can have breast cancer. Anyone with breast that has tissues, you have a risk of developing breast cancer. Most men won't step forward because guess what? I'm a man, I can't get breast cancer. So it's important to educate not only women but men too about breast cancer. And as a community, and as just a church family, and even families alone, we're gonna have to start at the end of the year. I know a lot of, and it's just cultural things, you know, I know growing up, a lot of illnesses, disease were kept a secret, but we're gonna have to start putting out, at least once a year, and just sit at, have a family meeting and talk about what disease you had this year. You can save your child life, your cousin life, just to have the appropriate testing. We got to change cultural things that we've been going through for years to bring awareness. We have to. A lot of it can start within the home, within the community. So enough of that. So just breast cancer, like I said, it arises from abnormal cancer cells within the breast tissue, lymph nodes. Mammograms are very important, starting at age 40. The median age of getting breast cancer is just the middle, 45. Women ages 65 and years and older are also at greater risk, but especially those women, young ladies that start periods before the age of 12, they have a higher risk because their bodies are exposed to the hormone changes that they go through just by having early cycles put you at risk. Menopause, because most times women that go through menopause, just to combat the symptoms of the hot flashes, night sweats, they have to take estrogen and progesterone therapy. And that alone, those hormones that you're taking, they put you at risk of developing abnormal cancer cells that put you at risk of having breast cancer. And just a long risk factor being African American, hereditary, as I mentioned, family history. So there's a lot of things that we can do. Smoking even put you at risk. And most of the people that see me here that are my patients, I'm very heavy on quality measures. Those are things like having the mammograms, the prostate cancer screenings, and just that alone can help save your life. Doing a self-breast exam once a month, and you know I'm guilty because I don't do them, but I'm also at risk myself. So it's very important to even just do a simple breast exam. If you notice changes within your breast tissue, just the way it looks, dimpling, your skin looks sort of like an orange, like a peeling, that puts you at risk. Any discharge, you know normal breast you shouldn't be draining if you haven't had a baby, post-op, delivery, you know that's abnormal. If I go out and tell you a house yellow and you say, well, this house little 10, I'm gonna go in. So I really don't like to say so much like what a lump can feel like, because whatever you feel like, oh, she said it don't feel like that, so you're gonna overlook it. So anything that's abnormal from your normal, go get it checked out. Clinical breast exam, pap smears. You know, a lot of people, well, I don't have anything, I don't need a pap smear, but the pap smear helps screen for cervical cancer cells. As I mentioned, ovarian cancer puts you at risk. So if you know you're having real bad stomach pain all the time, especially in your pelvic area, get imaging. It could be some type of ovarian issue going on. So it's just very important to have those screenings done. Chemo, radiation, it does so much to the body. You know, now technology has upgraded so much. You know, now you can do targeted therapy where they just put the beam on you, just kill the cancer cell. Or the chemo, you know, they got it in pill. And like they said, that pill, just going through chemo or radiation alone, the toll it takes on your body. Some people have to go to a mastectomy, not one breast, but 2 breasts. And just identity alone, I'm a woman. You know, when you put your clothes on, you always go back in the mirror for a second, look at them, probably 3 or 4 taking selfies. But you know, identity changes a woman together. So that's why I say support groups. We can walk around and say, oh, I'm okay, but deep down inside, your appearance has changed. Going through chemo, as Ms. Williams mentioned, you know, issues with her skin. We just got to be better at joining and beginning a support group here in Marion. And even not that, just survivors got to form a support group to make those aware that's going through the transition, like this is what to expect. If you know what to expect, you're like, okay, but she said this works for her. Maybe I should ask my doctor about getting this pill just to help with my appetite, help me from vomiting, helping me with the metallic taste I'm gonna have in my mouth, because I'm not gonna want to eat just because I know this radiation is gonna mess with my taste buds. So it's so many changes that the body goes through with that. And like I said, I could stand up here and go through breast cancer all day, but the main thing is being a support to those who are going through it. But like I said, I just thank God for having the gift to educate and advocate to you guys, my community, about breast cancer. And most of you know I'm at Cahaba Medical Care, right down the street on Washington Street. You're welcome to come see me anytime. But like I said, education is what's going to help save lives. All right.
Let me give it up to Ms. Lashandra Walton. I want to do something special.